Thank you, everyone. Thanks for being here today. We have yesterday's state's numbers and we have today's Boston numbers, so I'll start with those. Yesterday, in the state of Massachusetts, 77,793 cases statewide. That was an increase from 1,050 from Saturday to Sunday. And the state now has reported 4,979 deaths, up from 139, and those numbers are from Saturday to Sunday. The Boston numbers for today, we have a total of 11,106 cases. That's an increase of 59 from yesterday, and 533 people have passed away, an increase of 8 from yesterday. And I just want to, again, just pass along our thoughts and prayers for those families who lost loved ones, and also those families that are struggling with this illness. The Boston Hope Medical Center is currently serving 164 patients. 82 on the shelter side, 82 on the hospital side. Altogether, we have served more than 650 COVID patients at the convention center. Boston hospitals are at a combined 110% of normal ICU capacity. That number has come down somewhat, but obviously it's not where it needs to be yet. And we need to continue to make physical distancing, face coverings, and good hygiene a priority. Some updates on testing. By the end of last week, we had conducted a total of 36,072 tests, or roughly 5% of the Boston population. Our rate of positive tests last week was 20%, bringing our overall positive test rate down to 29%. Every neighborhood saw its positive tests go down, and that's a testament to the physical distancing residents are doing and expanding testing citywide. I want to thank you for that. The neighborhoods with the biggest reductions last week were East Boston, with a 19% drop in positive results, and Mattapan, which had a 15% drop. That's a testament to the hard work of our Healthcare Inequities Task Force, and also the ways we're targeting outreach and testing to our most impacted communities. And as that work continues, I want to thank everyone involved there. I also want to thank the residents in the community who have done some amazing work by practicing physical social distancing, wearing face masks, and doing all the things that are important. I'm going to continue to offer updates today on some of our top priorities, including testing and support for individuals experiencing homelessness, addiction and recovery services for those dealing with substance use disorder, public spaces ideas we are looking at to improve physical distancing, and situations in nursing homes and other long-term facilities. I can start by sharing that our first round of universal testing for the homeless population was completed at the end of last week. We have tested over 2,200 individuals, 735 tested positive, for a 33% infection rate. We've also provided those individuals with quarantine space, support, and medical treatment as necessary. That was an important goal. It was to make sure we could support and care for a very vulnerable population, and also slow the spread overall of the virus. Starting in March, we created hundreds of new beds for that purpose. We secured new sites and increasing spaces in our shelters, and we dedicated 500 medical respite beds for homeless individuals at Boston Hope Medical Center. The result is that severe illness has been kept to a low level and medically vulnerable population. The consensus of those who work in the homeless community is that the impact could have been much worse. So I'm grateful to everyone who worked on this priority. It's a testament to the partnership between city staff and nonprofits like Healthcare for the Homeless and Pine Street Inn, and institutions that stepped up like Suffolk University, Boston University, Northeastern University, and Emerson College. Homeless individuals and families remain a top priority for all of us here in the city. There is more work to be done, including more test and longer-term shelter spaces as we move forward. We're also working on permanent housing solutions. We're currently helping 1,000 families of Boston Public School students to secure affordable housing using the Boston Housing Authority's rental voucher plan. We dedicated it for this purpose. And when construction restarts, it will make it a priority to create more supportive housing for homeless, continuing the progress we have made towards ending chronic homelessness in the city of Boston. I also want to make sure that everyone is aware of our addiction and recovery services are fully operational. Before the COVID pandemic, we had a substance use epidemic in this country, with Massachusetts as one of the hardest hit states. That epidemic continues today and every day through this crisis. Although we will get through the crisis, it will still be with us. So our staff at the Recovery Services, led by Jen Tracy and Devin Larkin, have not missed the beat. In fact, they have worked hard to adapt their services to the crisis and conditions. Among the changes they have made, harm reduction services that help active users stay safe have been moved outdoors. Outdoor space at our engagement center was expanded to allow for physical distancing. Our street engagement team has remained very active. We've created comfort stations with bathrooms, hand washing, Narcan for overdose prevention, and many other opportunities. We're actively looking for additional locations. We work with the faith community downtown to help them open up new daytime spaces. Outpatient treatment services moved to a telehealth model and by all accounts are working well for all patients. We're doing universal testing at our residential programs. And we continue to help people who already get into detox and treatment. Finding beds for inpatient treatment after detox remains one of our biggest challenges. It has been for some time now. The bottom line, those with substance use disorder have remained the top priority and will continue to remain a top priority. Public spaces and transportation have been a focus of our response from the very beginning. We started by making sure hospital staff and other frontline workers could get to work safely and affordably, with parking discounts, forgiveness of parking tickets, and free bike share access. We preserved access to open space in our parks while closing facilities like playgrounds, basketball and street hockey courts, tennis courts, soccer fields that bring people into direct contact. We ask people to stay home as much as possible, but at the same time, we want people to be able to get fresh air and exercise safely. We have the best access to parks of any city in the country, and we are drawing on that strength while working to make sure our open spaces don't become overcrowded. But as summer approaches and as the weather brings more people outdoor and as we prepare for a phased reopening, we want to make sure that we have enough space for safe distancing. We want to make sure our small businesses can get the support they need, and we want to make sure everyone has safe and healthy transportation options. So in addition to our planned capital investment in safe and sustainable streets, we've been looking for ways to expand space for pedestrians, small business customers, cyclists, and bus commuters. The things we are thinking about include expanding sidewalks in business districts that could help with physical distancing, especially where people wait in line for businesses that are following new capacity guidelines. Opening up entire lanes for pedestrians and cyclist use, which could also calm traffic speeds. We would need to do this in a way that does not cut off emergency vehicles or delivery access for residents. And expanding bus stops and making bus priorities on the road. While subway ridership is down, we are seeing essential workers continue to rely on bus routes. If these ideas will help us meet our goals, we will develop proposals for specific locations to share with the community for the feedback before moving forward. This is an important issue for a safe recovery, and we need to have an inclusive conversation to get it right. My final update today is an issue that is central to the pandemic and on the minds of many families. It's the impact in nursing homes, assisted living, and other residential facilities for elderly and medically vulnerable individuals. The data from nursing homes and senior care facilities is of deep concern. In fact, it's devastating. And it's consistent with the impacts we've seen statewide and nationwide. Our prayers are with all the families who have lost loved ones. And our focus is on the residents and staff who are struggling with the fear and uncertainty. These facilities are licensed and regulated by the state, so our work in these areas is tied to the state's effort and done in collaboration with them. But I want to assure residents and families and staff that we've been in constant contact with elder care facilities since the beginning of this crisis in the city. We speak with administrators of these institutions every single day, and we're doing everything we can to get them the resources and the support that they need. We created a disease containment strike team to be ready to help any facility facing an outbreak. Currently, we're actively supporting 9 facilities. As of May 5th, we have provided over 414 staff shifts, which includes nurses, nursing assistants, and personal care attendants. We've also worked to help administrative supports in these facilities. We've provided 206,000 items of personal protective equipment, including 62,000 surgical masks, 6,000 face shields, and over 14,000 gowns. I pledge right now in the city that we're going to continue our support for our nursing homes and their residents. They are the most severely impacted in this crisis. That includes the families with loved ones in these facilities. I know there is a desire for more information, but we do our best to share the data that we can while respecting confidentially a person's health data. The state has data from Boston's facility, and we want to share that data on a weekly basis starting today. As of May 9th, across 39 facilities in the city of Boston, 252 residents have passed away. That's 48% of our citywide total. We pray for all those individuals and their families, and I know their families whose loved ones in a facility. There's nothing more that can remove the fear or concern when you hear those numbers. It's especially hard when you can't visit your family member. We'll continue sharing as much information as we can. I also want to speak directly to the residents of our nursing homes, assisted living, and other care facilities. Too much of the conversation is on the issue has been about you, and not enough has been said to you. I want you to know we see you. We are thinking about you. You are loved and valued. You have contributed more to our city than anyone will ever know. Many of you served our country. Many of you raised your children and worked for the institutions that we're relying on right now in this crisis. You dedicated your lives to making our community stronger, and we must dedicate our efforts to your safety and dignity, not just during this crisis, but at all times. We owe you everything. We are working every day on ways that we can support you and help keep you safe. And to all the nursing homes and assisted living staff, you have also been the subject of conversation and generalizations. I can't imagine how hurtful it is when you go to work and work so hard under such difficult circumstances. You are the ones going to work every single day, dealing with this issue directly, and doing everything you can for the residents. I want to say to you, we see you. We are listening to you, and we support you. You are truly unsung heroes in this crisis, and we thank you for everything that you're doing. And now with that, I'll open up for questions.
Just want to clarify that last one you made. 252 people, 48% of residents of nursing homes died here in the city of Boston.
Let me 252 residents in nursing homes, which makes up a total of about 48% of our total people who've died in Boston.
Yeah. I just want to ask you too, Mayor, about the governor's announcement today about phased reopening.
Yeah.
How is that going to look in the city of Boston? Do you know what businesses might be able to begin that reopening process?
No, I don't think any of us know what the businesses are yet. I think that the governor's approach, the phased reopening, in my opinion, is the right way to do it. And he has 4 phases that he laid out. But in those, I don't think he was specific on what areas open up first. And I think that's where input from us in the city and other cities and towns across the Commonwealth are going to be vital for the governor and for the team. Part of the reopening advisory committee is working on that now. We have people here at City Hall, teams working here with the private sector. I'm going on a call tomorrow at restaurants. I was on a call last week with colleges. I'm going on another call this week with colleges. I've talked to the Chamber of Commerce. I've talked to the hotel industry. So we're going to continue to have those conversations. I think as long as these different areas can prove that they can open safely, and I think as we do the phases, when we get into certain phases, that should be what we use to open them up. I also think it's vitally important to look at the data. The data is key, in my opinion. If you look at the numbers in Boston over the last 2 days, you'll see a downward trend. Yesterday, I think we had we had 90 cases yesterday. Today we have 52. So it looks we haven't been this low in positive cases since March. But 2 days of downward trend doesn't give us information. It really is looking at over a 14-day period, and I'm expecting tomorrow's numbers to go back up. Same thing happened last week. Sunday and Monday's numbers lowered, and then Tuesday we jump back up. So again, we're monitoring all those different data points.
Businesses an idea of which ones may be able to actually open up ahead of that date, or?
Yeah, I think that's probably the intention of the governor. I think certainly we'd want that intention as well, so that we could think about, what does it mean? Hypothetically, I don't want to give a hypothetical. Hypothetical business opens up on the list to open up on the 18th or the next day, whenever it is. We want to make sure they have the proper protocol in place, the proper PPE that they need. Depending on what the industry is, are they doing cleaning? We would want to inspect that in the city, because our inspectional services would be responsible for making sure that all the safety protocols in place. With the construction industry, we started the conversation about a month ago. and we've been in constant contact with them about it. So they have a really good plan in place, and you know, they've been doing some essential construction. So some of the plan has been working there. When we start to really see bigger projects happening, you know, we'll be able to monitor even closer.
What about for office buildings? They're not very outward-facing, customer-facing, but you could argue that people have been capable of doing a lot of that work at home. So where do they fall on the spectrum of being able to get people back in these high-rise buildings back to work?
I apologize for everyone watching. I didn't repeat the first two questions. The first question that I answered, it was on nursing homes. The 48% of all of the deaths in Boston were a result of nursing homes. And then we got into a conversation around construction. And now the question is about office buildings. Where do they fall into the scope kind of reopening and how they can physical social distance? I think office buildings, I think there's a couple things we have to take into account. And I only speak for City Hall. We're going through the exercise right now. How do we open? How do we open responsibly? We won't be opening 100% capacity. We'll be opening probably 25 to 50% capacity. We'll probably be looking at doing possibly shifts. We also, for the city, anyway, I'll speak for myself, we're going to be keeping an eye on our most vulnerable population, folks that are in that age bracket that have pre-existing health conditions, whether or not can they work from home, do we want to bring them into the building. So we're working through this process right now, and I'd recommend the same for the office buildings. Think about, you know, who do you bring back? Can you do social distancing safely inside your office building? The building itself, you should be in contact with the managers of the building to see how the elevators work, the stairs work, all of that stuff. And I think things will get clearer as we move more towards the date of the 18th. Even though the 18th is 7 days away or 6 days away, I find a day is a lifetime in this time of coronavirus, and literally things change hour to hour. And I think as the week goes on, I'm not sure if office is going to be on the first phase, but I think that any industry that's on the first phase will be thought through.
As far as what you mentioned at the end, as far as transportation and those additional lanes in the street, widening sidewalks, are there particular neighborhoods or areas that you thought that would apply, you know, in a good way?
Yeah, the question is on what we're talking about with the widening of sidewalks for businesses and more dedicated bus lanes. We're doing this really for looking at it to help business when they come back. So I'm going to make an assumption here that when restaurants open up again, they're not going to open up at 100% capacity. Many of them don't have outdoor dining. Is there a way for us to give them additional capacity by possibly using outdoors in some locations? It doesn't work every part of the city because of the tight sidewalks and the tight streets, but we're going to look at that. On the buses, looking at, is there a way for us to you know, help the MBTA if they want to increase capacity on the buses because of physical social distancing. You know, but some buses, I'll use South Boston as an example. Those buses are packed in the morning, and you know, when we start to go back to work, as people start to go back, people might not want to be excited about being on a packed bus, so they might want to increase frequency of the buses on the roads, which we could potentially look at doing dedicated bus lanes temporarily, maybe long term. So we're going to try and be creative. Other cities in the world have done this. They've done it in London. They've done it in England. They've done it in some other places as far as the cafes. So really what we're doing, Seattle has done it with the restaurants. So really what we're doing is looking at best practices around the world and the country and world to see what works. And if they work and it can happen here, why not?
So I just follow up to that. Like, for instance, Hanover Street, would you consider the north end, they don't have a whole lot of space inside a lot of these restaurants.
Yeah.
So if you bring their tables out onto the sidewalk, would you consider shutting down Hanover Street altogether to vehicle traffic?
Yeah, that's been brought up. You know, there also has some public safety aspect to it. And Hanover Street's not necessarily a grid, so going up and down, if you had a street that ran parallel to Hanover that was going the opposite direction, if you had a couple, you could. So again, we're going to be looking at all the different ideas, and we're going to be reaching out to the community as well for input. I think that we have a little bit of time here before some of these restaurants open up, and it's going to be, you know, it's something that we should look at. I mean, that's been brought to me several times about Hanover Street, and I think it sounds great. Shut it down, and let's bring all tables out there, and just like we do in Newberry Street when we do open Newberry Street. The concern is, and some people have brought it to me, is the public safety aspect of it. We have a fire station on Hanover Street that services the area, so if we're limiting the fire department to only go left out of Hanover Street, that could cause a public safety risk. So we have to think about all those different things.
Walsh, could you please provide an update on the like you guys are going to be doing to the market?
Yeah, we're still waiting. This is the third time this question came up today. The question is on the antibody testing that we did with Mass General. We didn't last week. We didn't get the full 1,000 people we needed, so we were reaching out, getting more people, and I believe it's going to be out this week sometime. Do you want to jump here for a second?
Yeah, so we've finished sort of the testing we can do and get as many folks as we can, and plan to have results this week, working with MGH to sort of look at what the results say, and then after the mayor will release the results.
And I'm assuming everyone knows that. That's Marty Martinez, Chief Health and Human Services for the City of Boston, so I think everyone knows everybody now.
Just one thing, circling back to the press conference, I think it was last week, as far as like the 4th of July and these big celebrations that have been canceled, unfortunately. Just a point of clarification, I saw you say on Twitter that the New Kids on the Block concert could still come back for Fenway Park. And I'm curious about other concerts during...
Yeah, I would... Sorry, the question is to clarify, and I'm going to thank you for asking me that question, to clarify what we did last week with the canceling of parades and festivals in the city of Boston. All of those events are on city property, sponsored by, most of them sponsored by the city. That's what I was talking about. New Kids on the Block is part of the Fenway Sports Group. I believe they're going to do a concert at Fenway. As of right now, that has not been canceled by Fenway. Again, I think it's sometime in August, maybe, the concert. So we have no idea where we're going to be in August. I made the decision to cancel parades and festivals because there was a lot of questions swirling around. Should we have it, not have it? And we just made the decision. Now, if we're in a different place in August in society and we get to 0 cases, then I'll be having a different conversation, and we can always rescind whatever we want to do. But as of right now, they're two different things. So, yeah, Joey McIntyre tweeted at me, and then we tweeted back at Joey just to say that, that's a different situation. It's like baseball. Baseball announced today that they want to do 82 games starting in July, which is, I'm excited about it. I'm not expecting fans to be in the stands in July right now. Maybe there'll be fans by the end of the season in playoff time. But I think when the season starts, and I hope I'm wrong, as I always say, I hope I'm wrong in this stuff, but I would expect that baseball is going to start without fans in the stands. I could be wrong, and I hope I'm wrong. And your mask has the Bruins on, and I hope the Bruins and Celtics come back as well, because I'd love to see them in the playoffs, because they both have good teams. But again, this is all very fluid situation.
So it's like for the Garden as well. So you cancel these events, the publicly sponsored ones, the ones that are on city property.
City property.
So the ones that aren't.
Yeah, the ones that are ticketed, you pay a price in, that might be a little different. I don't know if they're going to try and do something with physical social distancing in the stadium for baseball or hockey, put seats between. I'm not sure what they're going to do. Those conversations are all happening now as we move forward here.
How is the compliance to the mask ordinance going?
I mean, I think it's going good right here. Everyone around me has a mask on just about, so I like that. I think this weekend, I saw a lot more people with masks on, and we're just asking people again. We have this week some rain today. I think rain next couple of days, and it gets beautiful. We're going to ask people when you go out for a walk, wear a mask. If you're going to be in a store, wear a mask. If you're walking down the street and you're all by yourself and there's no one around you, if the mask is down a little bit, that's fine. But as you're coming upon people, if you could pull it back up, that's what we're asking for. I think that it's not a lot to ask to try and stop the spread of the virus. Clearly, if you look at the numbers today, the numbers have gone down a bit in the last week. I attribute that to physical social distancing. I attribute that to people doing everything they can not to get this thing and not to give it away. So the virus, that is. So it's kind of a day-by-day thing. No, we haven't. I mean, listen, the last thing I want to do is give a citation out for this. If we have to, if it gets out of control, we will. But the last thing, quite honestly, I'll speak for Boston. I don't want to give a citation out for this. I think this is incumbent upon individuals to take the responsibility of wearing masks. I really don't want to get into that. We will if we have to, but I don't want to. All right? All right, Ron, thank you.